Hello, everyone. Good afternoon. Thank you for being here. This is the Recovery Science Echo. Today is March the 20th. My name is Andrea Havler, and I will be helping with facilitation today. Our facilitator, Shreya, is not with us, so I'm taking over facilitation for her. Thank you to all of you for being here. Before we start, I want to remind you that this session is being recorded for later distribution. You may find this session in approximately 2 or 3 weeks in our Be Well Texas YouTube channel if you'd like to revisit the conversation and the materials distributed today. The information that you see on the chat will not be on the recording, so please feel free to add your names, affiliations, email addresses, etc. on the chat. We will use this information to confirm your attendance, especially if you're looking for CMEs today. If you need captioning for this class, all you have to do is navigate to the bottom part of your Zoom window and click on the captionings option. This session, of course, is made for you, the learner, so we want to encourage your participation. Please feel free to express your views, opinions, and perspectives during the session, especially on the second part of this class while we are discussing our case. So with that, I think we're going to be moving to introductions very quickly. Sierra, would you like to introduce yourself to the group, please?
Absolutely. I'm Sierra Castedo de Martel. I'm a postdoctoral fellow and I'm a hub member.
Thank you. Emily.
Hi, I'm Emily Hennessy. I'm a hub member and I am a researcher at the Recovery Research Institute at Mass General Hospital.
Thank you. Cheryl.
Hi, everybody. I'm Cheryl Pacapelli, a person in long-term recovery and the project director for the New Hampshire facilitating organization overseeing the recovery community centers in New Hampshire. Welcome.
Thank you for being here. Robert.
Noon or morning, depending on where you're calling in from today. Y'all, I'm Robert Ashford. I'm an assistant professor at the University of Texas Health Science Center, San Antonio, Be Well, and one of the PIs on the Peer Recovery Innovation Network. Thanks for joining us.
Thank you. Our case presenter, Taylor.
Hi, everyone. I'm Taylor Vaziju. I'm an evaluation analyst here at Be Well, Texas.
All right, thank you. Daniela.
Hi all, I'm Daniela. I'm the project manager for the Peer Recovery Innovation Grant, or PRIN. Nice to see you.
All right, and last, our speaker and Patrick Hibbard. Thank you very much for being with us today. Whenever you're ready, you can introduce yourself and start with your presentation.
Absolutely. If you want, we can put the slides up now if you'd like.
Of course.
Be a little bit easier than looking at my big head. I'm Patrick, I'm Patrick Hibbard. My poor kid, he has a giant head too. I'm a postdoctoral fellow at Chestnut Health Systems, Lighthouse Institute. Also, I have a connection to Project ECHO. I'm the evaluation specialist with the Indiana Peer Education Program, which is run out of the Project ECHO at IU Indianapolis. Also, I'm here in New Mexico, in Albuquerque, where Project ECHO all started with Dr. Rohr and all of that stuff. Love the ECHO design and all that. Also, formerly incarcerated scholar in long-term recovery, so I have direct lived experience with those issues. Next slide. A couple of disclosures, the usual boilerplate stuff. I don't have anything to disclose. Next slide. Some learning objectives, and let's dive into it. I only have like 20 minutes, and I like to talk a lot, so I'll do my best to kind of keep it brief. Next slide. So first, let's talk about, this is basic quantitative evaluation stuff, right? Correlation is not causation, dude. There's a strong correlation between the number of Nicolas Cage films and pool drownings in the U.S. Right? Next slide. So, but we could say that's probably, Nicolas Cage films do not cause these drownings. Or we could look at it the other way, right? Like, God, more people drowning seem to cause Nicolas Cage to have more films. Probably doesn't work that way. But actual causal inference is really difficult to make. It's really hard to get at causal effects. So the problem is, it's more about plausible correlation versus spurious causation, right? Does X cause Y? Or, more specifically, what we end up measuring is, do changes in X cause changes in Y? And there's a few ways to do this. The so-called gold standard, and I say that because I have to fight against RCT people all the time, is the randomized controlled trials. But this is like really difficult to do and really expensive, and I think sometimes kind of misses the point. What we end up doing with RCTs is we have to like take out all other factors and only look at this one little item, right? Does the change in this cause change in Y? And life isn't always like that, right? Life is very busy. Life has complicated, what's happening in Texas is going to be different here in New Mexico, where Sierra's at now in Michigan, right? So we know life is complicated. It gets really tough. So we have the next best thing, quasi-experimental methods. So I threw in a little second place ribbon there. Next slide. And some of the differences, our randomized controlled trials is randomized people between, do they get the thing or do they not get the thing, right? We do drug trials, right? We get 100 people and randomize 50 to get the drug, randomize 50 to not get the drug, and see if there's any difference in the outcome that we're interested in. And it isolates everything except for the intervention so that we can try and get that causal effect. Quasi-experimental, unfortunately, there's a high potential for spurious causation, like Nicolas Cage films and pool drownings. But we do a lot more work. I think I wouldn't be in a job if it was easy, right? We do a lot more work to try and get at causal inference, or at least plausible correlation that changes in X cause changes in Y. And the couple of primary approaches to this, one is working with the data ahead of time so that, there's a couple of ways to do this: pre-analysis, processing. Usually it has to do with some type of matching of people who got the thing or people who didn't, or communities that had the policy change and communities that did not, stuff like that. And I'll even say, the randomized controlled trial is a way of pre-processing your data, right? Like, to get at true 100% causal inference, we would, get 50 people who took the drug, and then we would go back in time and get those exact same 50 people and not give them the drug. And then we would measure the difference between them. So it's, in essence, what we're doing with randomized controlled trial is we are doing some pre-analysis processing. And then, of course, we get into the analytic methods, which is kind of mainly what I'm going to talk about. Next slide. Some of the pre-analysis processing approaches, mainly what I end up doing, can we do the next slide, please, is I do a lot of data matching between, usually I do like community level stuff. So did this thing change in this community? If yes, then they're in the treatment group, and then there's a whole bunch of communities that it didn't. And I try and build a control sample that looks a lot like the community it did. Let's say, so there's a couple of pointers. I have a reference at the end of this. Please don't do propensity score matching. There's other ways to do it. They're super easy. We don't need to go down that road anymore. So a lot of what I end up doing is called nearest neighbor matching. There's a couple of ways to look at it. There's exact matching, and then Corson matching, which is usually exact matching, as you'll see in the sample, is like by sex or gender, race, things like that. But then when you have, like, we're doing a study of reentry program in Oregon, they have these PSC scores, which is like a risk score. And the probability of getting two people, or 4 nearest neighbors that are exactly the same PSC score, is very low. So what you do is you widen up the calibers a little bit, so you get people that are like within 5%, right? Usually I do a 95% confidence interval. And so if you look at the sample, we'll see that, you know, to matching the person number 1 to the control group person number 3, or people in the control group 2, 3, 4, and 5, you'll see that person number 4 has the exact same PSC score, but is a different sex and is a different race. So we probably want to boot that person out, match the 3 people that are pretty close in the PSC score, but you know, match exactly on the sex and race. Next slide. So then we get into the methods, which is kind of what I love talking about. You know, try and go quickly, but you know, and if there's any questions or if I'm going too fast, please feel free to jump in. So analytic methods, the ways that we get to try and get the plausible correlation. First off, I'm pretty sure all of y'all have heard, we controlled for this, or we controlled for gender, or we controlled for whatever it happens to be. That's one way to do it. Things get a little bit tricky though, because that's not always, it doesn't always get us as close to plausible correlation as we want. So there's in econometrics, we call it an identification strategy. We're trying to identify the effect of changes in X on changes in Y. There's a few ways we approach it. Some of the main, the usual suspects, difference in difference methods, fixed effects, which is kind of the same thing. It's extended. The Venn study is also an extension of difference in difference, regression discontinuity design, and instrumental variable analysis. Next slide. So difference in difference, essentially, let's say we start in a county in Texas. We start a peer recovery support services in 2020 in 5 counties, and then the rest of the counties we do not. Essentially, you take all those treatment counties that you started the PRSS and the ones that you did not, assuming that they didn't have any to begin with. Big assumption, I know, but stick with me for the sake of argument. And what you do is you take, say year 2022, maybe, or 2020, maybe, hospitalizations for drug poisoning or whatever your outcome of interest is, and you subtract both counties' 2020 numbers from 2019. So that's the first difference. And then you subtract that difference in the treatment county from the difference in the control county, ergo the name difference in difference. Mathematically, it works out almost exactly the same if we just set up an equation with all of these counties and years and all of that to get to the same effect. That's how we end up with fixed effects. So like if we had 10 different counties that started PRSS at 10 different times, and then all of the other counties that did not, we could set that up in an equation to find almost exactly the same result, which ends up in the difference in difference. So next slide. And I'll say the difference in difference tends to work better at larger units of analysis. We can do it at smaller units of analysis, but it's really hard to get that much data to do stuff like that. But what you do end up with a lot with in quasi-experimental, when you have a whole bunch of individual people as your units of analysis, is a regression discontinuity design. So let's say, you're doing a study that people get until the age of 18, right? And so, or till the age of 50, if we'll stick with the chart that's here. And so what we can do is the people that are getting peer recovery support services up until age of 50, the people that are like 48 to 50 are going to be a lot more similar to the people that are 50 to 52 than the people at 18 are going to be to the people at 80, right? So that's what this is working off of, is wherever that cutoff is, you weight those people more in your equation than you do with the rest of the people. They do enter into the data usually, but it's based off of the people that are more similar. So you see this with a lot of cutoffs. You see it with in medicine, you see it with like a cholesterol score, right? If the cholesterol score is so high, then certain people get the drug, but if it's low, people do not. And so people really close to that cutoff, you can measure those people and assume that they're a lot more similar than others. So let's go to the next slide, the Venn study. This one, I threw this one in because I really like it. I made this graph. This is drug courts in the United States. And what we're doing here is essentially on the bottom, you see that there's 0 and then -1 and -5, and then 1 up to 5. Those are relative years. So 0 would be the year that a county opened a drug court. -1 is the year before, -2 is 2 years before, and then we have 1, 2, 3, 4, and 5 before. And essentially what this does is the same thing as the difference in difference we talked about, but it gives us an effect for when for the years before and the years after. And this becomes important because, so I'm measuring crime here. I think it's plausible that a county that is experiencing increases in crime might open a drug court. So we end up with reverse causality, right? So, there's the Nicolas Cage films causing pool drownings, or pool drownings causing Nicolas Cage to get more contracts for films. And so if you look on the left side, what we're trying to see is if there are effects on that side, one way or the other, then we can probably say there's this problem with reverse causality or parallel trends also. But as you can see on these graphs, there wasn't a strong correlation. So we probably think that the effects we see from drug courts on crime at the community level were after. So next slide. Instrumental variable gets a little weird. Sometimes you have not only that reverse causality, but you have things like, say in the drug court case, you have elements within a community that mean that the drug court is going to have a bigger impact on crime, right? We call it exogeneity, right? Or you have, so one way to get around that is a two-stage equation. And what you're looking for is something that impacts the intervention, something that predicts the intervention, but would not have an effect on the outcome of interest except through the intervention, right? So this is a good example. So people with different blood types are stronger candidates for transplant, but we know that people with different blood types, that has really no impact on your overall health. So we can use that correlation between your blood type and the probability of getting a transplant to more accurately figure out if getting a transplant prevents death within a year, if that makes sense. Again, any questions, feel free to jump in. And then next slide, we get into a little bit of network analysis. This gets really complicated. But what it does, what a lot of researchers do is try and look at either individuals or organizations and what the network looks like, right? So I've seen this with public administration research. It's looking at these collaborations, whether it's disaster relief or stuff like that, and they try and figure out what configurations of networks are the most effective, like after a hurricane or something like that. But we also see it in individuals. Like I know some people out of I think it's Tufts. They're doing work on prisoner reentry and what people's social networks look like after they get out of prison, before and after, and which social network constructions seem to lead to the best outcomes, right? Lower recidivism, happier life, stuff like that. Next slide. There's also a way to look at how closely people work together. There's really strong theoretical basis for this. Relational coordination. A bunch of people out of Brandeis spent a whole bunch of work the past 20 years trying to figure that out. I like this because it's a very short instrument where Robert would score me on how well we work together on these factors of shared goals, shared knowledge, mutual respect, right? Frequent communication. He would not only rate me, but everyone else on the team. And then I would rate Robert and everyone else on the team. So each individual ends up with as many scores as you have on the team. So you have a good average. And then there's been a lot of research showing that people who work well together lead to better outcomes. They've done it in the airline industry and continuum of healthcare type of studies and stuff like that. So next slide. This is all to say, I can't do any of this evaluation work without good data. I'll give you an example of that drug court analysis on crime. Man, law enforcement agencies are awful at reporting crime. And so what I end up doing, you have two choices. And what I went with is limiting the analysis to communities where the law enforcement agency reported well within the study period. Or you end up filling in the gaps, right? Interpolating or, putting in, say, the Albuquerque Police Department reported 10 months out of the year, not 12. There are ways to fill in those gaps, but it's really just guesswork, right? So we really need good data if we're going to be able to do this type of analysis. So essentially, work now on your evaluation in the future, right? And figure out a couple of things, right? One, remember that we still want some type of control data, if at all possible. And whatever that looks like I said, a lot of times individuals, we end up with that regression discontinuity because there's some type of cutoff, and it's kind of the most ethical way, right? Like, who do you not give recovery services to? I would say nobody. Anyone that wants it, let's give it to them. So trying to figure out what that looks like, that can be difficult, but try and figure that out now so that as you get to the evaluation part, you have good data between now and then, and you give nerds like me something to work with. And so, that includes developing strict protocols that includes working with somebody like myself now to figure out how we could evaluate whatever the outcome happens to be in the future so that you can develop these strict data protocols, right? So I'm working on analysis right now. 2 different people coded. So people, therapists that did this intervention coded themselves on a checklist, and then people listened to the sessions and they coded how well the therapist did. It turns out those 2 instruments were different. So I'm now having to figure out how to put those together so that I can figure out inter-rater reliability from one to the other. Don't do that, please. Try and develop those protocols now so that when you get to evaluation in the future, people like me are, remain happy, joyous, and free. And I think with that, there's a couple of references on the next slide. If you want to get into any of the stuff, particularly, again, don't do propensity score matching. If you want to know how to do matching, just ask me. And then the final slide is saying, y'all are great. Thank you.
Thank you, Patrick. So I think now we can open the floor for some questions, comments. Anyone would like to say something about presentation or has a question?
Looks like Rob's jumping
Robert.
right in.
Yeah, I'm interested. Wonder if you could, I know our time is limited, but just, the 30,000 foot view of why not to do propensity score matching. And is it truly, I think I heard that it was just, there's easier and perhaps more effective ways to do it now with different methods. Is there other reasons, or why?
So there's the paper that I referenced, Gary King was the lead author on that. They did a whole bunch of simulations and they threw in different, so propensity score matching, you end up with one statistic that's a composite of a whole bunch of other things, right? Race, PSC score, whatever it happens to be. And the different elements that make up that composite can make it look different for different people, right? My PSC score is gonna push mine into this direction, whereas your previous, whatever some other component of that index number is going to push it in the same direction. though we're completely different, and there's different things that are pushing it in that direction. So the work that they did in those simulations actually showed that sometimes propensity score matching can introduce more bias than it's trying to alleviate. So, and they did a whole bunch of math behind the scenes. And if you're a super nerd like me and love to read those types of articles, please feel free. And yeah, Gary King does a whole bunch of great stuff. Any other questions?
Questions, comments? Before we move to the second part of the session.
I'll be really quick, but this is great, Patrick, for also the nerds like me. If someone wants to talk to a friendly neighborhood researcher, what would you think would be kind of the best approach to make sure that all your recommendations are followed?
Yeah, I mean, one, like if you have funding, find somebody to put on your payroll, right? Other than that, like, I mean, a lot of us, we just, like I said in the slide, we love talking about research. I wouldn't hesitate to give half an hour or an hour. And especially, there's a whole bunch of us researchers now coming up through the pipeline who are in recovery and who love to talk about research and recovery. So if you really want to get somebody's free time, talk about doing recovery services research, and we're more probably going to answer the call and spend an hour or two talking to you about, how we might work this out. I agree with Rob. We also agree. We also like to hear ourselves talk.
Okay, so in the interest of time, we're going to be moving to the announcements, but we may revisit some of this content and some of the didactics while we're discussing the case form as well. So, Karen, if you can post the announcements, please. And remember, if you want to claim your CMEs, all you have to do is text the 10-100-95647 to the number that you see on the screen. Please try to send this text before tonight at midnight so you can retrieve your CMEs. Next. And for this, I'm going to give it to Daniela, who's going to give us a brief explanation on the PRIN survey. Daniela.
Hi, everyone. I don't know if you've heard about this, and if you have, I'm sorry to be repeating myself, but if not, the grant that is, funds this effort, we are conducting a short 10-minute survey because we'd like to know if, what research should be looking at in the areas of recovery support services. Some folks have worked really hard in coming up with a list of priorities that think are relevant for the field and to keep advancing recovery science. But it'd be great to get everyone's input on whether you think that is what's relevant or not. So I know the ECHO team is going to be dropping the link there so you can take a quick online survey. You're welcome to scan the code right now if you feel like it. And if you have any other questions, you can feel free to reach out to me as well, and I'd be happy to work with you on that. And Robert, if I'm missing anything, feel free to jump in.
No, I'll quickly say also in the interest of time, everybody on this, we'd certainly welcome your feedback. But for those of you that may work at RCOs or other peer organizations as peer specialists, peer supervisors, et cetera, or be a person with lived and living experience, it's even more paramount that you provide your feedback, as this agenda is going to lead to a lot of pilot research funding in recovery science, as well as some of the initiatives for PRIN in years 2 and 3. So please, please, please fill it out. It will not take long. And oftentimes, I think with fatigue, we're often asked for feedback that doesn't often lead to change. But when I say this leads to pilot funding, it does. So please fill it out. There is some tangible outputs that are going to come afterwards. So would love y'all's feedback and input.
Thank you, Robert and Daniela. And we just dropped, and we're going to be dropping again the link for the survey. So please take the time after the session to answer this survey. Thank you. And next. And if you have any research or evaluation related case that you would like to share with us, this is the perfect forum, the perfect space for you to bring your case or your project. You have a team of experts that will give you feedback, ideas, alternatives to implement and put into practice your project. So all you have to do is send us an email to bewelltexas@utesca.edu or cstat@bewelltexas.edu. We are dropping the emails right now in the chat as well. It's very easy. We'll provide you the case form. So basically, you will just complete the form and share it with us. Thank you. Next. And this will be the third session on the webinar, Thriving in Substance Use Disorder in the Post-COVID Era. This is an incredible 8-part webinar that was put together by the Center for Substance Use Training and Telementoring, CSTAT, in tandem with the Texas Human and Health Services Commission. This will be the third session. If you want to register, you can go to our cstat.org website and register. We're also going to be dropping the link on the chat again. And this is going to be Dr. Verduzco talking about the implications of long COVID in people with substance use disorder. Very important topic. Please don't miss it. That's March 26th at 12 p.m. Thank you. Next. And that's it. So I think for now, we can share the case presentation. Taylor, whenever you're ready, if you may introduce yourself, tell us a little bit about your role in the organization and what this case is about. Thanks.
Of course, thank you so much. Hi, everyone. My name is Taylor Baziju. I am an evaluation analyst at Be Well Texas. So this case presentation is mainly going to be trying to garner some support and help for one of our evaluation questions. So I'm going to go ahead and give you a lay of the land of what exactly this part of Be Well Texas is, because I know some people know bits and pieces, but we do lots of things. So what I do mainly is I lead the evaluation along with Dr. Vroom for the Recovery Support Service Network through Be Well Texas. The Recovery Support Service Network provides funding and capacity building to Texas providers through 5 different grants. This is through recovering housing for emerging adults, support to expand virtual and hybrid RSS in Region 11, which is the southernmost region of Texas, the border. Support the expansion of the RSS workforce, support RSS virtual programs through the purchasing of technology, and support in-reach services to individuals who are incarcerated and in rehabilitative settings. So currently, our evaluation is a holistic evaluation of all 5 of those grants. We receive this funding from the state of Texas, and then we act as a demi-funding source. The grants are not solely financial. Be Well Texas creates a support network for the grantees to increase the efficacy of RSS. And this support comes through training, workforce development, monthly support meetings, which facilitate resource brokering, problem solving, training opportunities, etc. So that goes to say, the program evaluation team is conducting this evaluation, and we would like to focus on our sustainability question, which is, to what extent is the RSS provider network being sustained? We currently are planning to examine how resource brokering was used and accessed by providers from RSS staff and other Be Well Texas departments and among the providers themselves, as well as assess if a sustainment was achieved by providers through fiscal year 24. Let's see. And so I think our main goal is we want to receive support from hub members, but also people who are working within recovery support and help further define and identify key indicators to evaluate sustainability for our holistic RSS program network. I know that was a lot, so feel free to ask questions.
Of course. Patrick.
wanted to ask about a couple of definitions. I think, well,
Mhm.
probably just one. With resource brokering, do you mean like between the organizations you work with, or them brokering resources for clients?
Yeah, so I think he's on the call. Richard, one of our folks here at Beeville, Texas, and Paul, they kind of coined this term, and they help in it's kind of a myriad of ways. I don't know if anyone wants to tap in there because didn't define it. There's Richard right there. Do you want to go ahead and talk about that, Richard?
Sure, you caught me between a bite of salad. But when we talk about resource brokering, we're really talking about the recovery coaches themselves. Many times are considered kind of resource brokers, right? So their whole idea then is to kind of help connect individuals that they're working with based on the recovery capital and some goals that they set to either help establish treatment settings, mental health, substance use. It can be helping them with legal matters or direction. It can help with education, housing, food pantries, any number of different resources that might be available in the community. And also from organization to organization, or just whatever who those community partners are, and helping them along the way in recognizing what the needs are of the individual and helping them connect to those needs. I hope that helps.
Yeah, that helps a lot. And I think because I think evaluating the two different levels of sort of interactions would be a lot different, right?
Mhm.
Like helping linkage facilitation basically with clients, like that's kind of one level where you may be able to work on that. I know as, an analyst, been trying, I would probably do it at two different levels and then compare, right? Like between organizations, and then how well they broker with clients.
Yeah.
You have like,
Because the programs themselves, they have several, like the ones that Taylor is describing. So we have some that are doing in-reach into jails and prisons and working with individuals there prior to release, and then post-release, connecting them to the necessary resources that they need. And those resources may be completely different than, say, someone who is just in the recovery community, and they may have more resource capital and they have other needs. So yeah, it can really depend a lot on the population and the people they're working with. Yeah, some of it's housing. We have a housing program as well. So
Yeah.
housing, what that looks like.
Yeah.
yeah, I noticed that, and I agree, right? Like the resources would look a lot different also between the contexts. So
Mhm.
super complicated. I love that.
That's why we're here.
I mean, hard to measure, but like, yeah, interesting. I'll shut up for now. I see other people.
It's good. Thank you.
Emily, you wanted to say something?
Oh yeah, thank you. Thanks for that definition as well. Because I think in my mind, I think about like community connectors, like that would be the term I might think of. But I did have a question around how you're thinking about sustainability for this question. Because to me, I'm wondering, is it that you feel like folks are those community connectors and then they're dropping out and you're losing that? Or is it more around like people staying sustained in the system? Like what kind of sustainability are you hoping to examine really with these questions?
Well, great question. I think there are a couple of things, and Dr. Broom, feel free to chime in. I think we're looking at, as kind of that DIMI funding source, looking at sustainability for the actual providers that receive the grants at this point in time, if that makes sense, because then they will also have their own, hopefully, program evaluation on their own. But does that make sense for the grantees? Is that the question? Is that what you were asking?
Like, well, I get, yeah. So is it like their ability to continue to be the resource brokers? Is that?
Yes.
Like,
Yes.
Yeah. And I think, hi, Dr. Annie Broom, I'm a part of the evaluation team at BeWell as well. I think another thing too, we're getting really in depth into the resource brokering, and that's just something that we've lovingly termed it's capacity building, right? So we want to make sure that we're doing capacity building, and we're doing different things to measure that. but it's capacity building of us as kind of this intermediary, right, entity that funds are being funneled through into these community partners, and in order for them to build capacity to be sustainable and so on and so forth. But as we've kind of already discussed today, this is super multi-level, right, of like evaluating what this looks like. Number one, even within our organization as Be Well, but also, and there's like this natural kind of dichotomy, and it's more than really two levels. But that's something that we're struggling with, right? Is even just defining sustainability. And I think Taylor did a great job, and I think that's kind of where we're at now. But I'd love to hear thoughts on what other people think about this, because what we keep running into is the idea of it changes day to day, right? We were just looking at interview data last week that was like, I can't speak to what this question is asking because every single day our needs are changing based on clients and so on and so forth. So it's how to evaluate that from the sustainability lens, and how to, as well as how to do that kind of in this, intermediary organization relationship that we have with the community.
I think Nick also has his hand up. Nick, hey.
Hi, everybody. I am a RSPS here in Austin, Texas with Communities for Recovery. I am one of those resource brokers. And I specifically I have an interesting spot to be in. I get to work with two different programs. One of them is the Be Well Housing Project. And another one is an emergency shelter, the other one's foundation. So I'm like part-timing both spots, and I get to see the overview of what both ends of the spectrum look like. And the resources that each needs is vastly different. One thing I feel like I should share with you at this point is that for those people who are higher recovery capital and maybe on that, and I hate to use this term, but like want something better for themselves, they're not just using their spot for like home base to go do whatever. We don't have a lot of resources for people with higher recovery capital already. There's a lot of organizations out there that are doing things to like, outreach. I do outreach some of the times as well, traveling all through the woods and helping people with the obvious basic essentials. But once somebody's got their stuff together, they're looking for things that like we just don't have available. And that might be something to think about for the future.
Thank you, Nick.
Thank you so much for that insight.
I'm trying to raise my normal hand like that. Do a thing. Actually, it might on Zoom now. Isn't there like a little hand emojis? Not on mine, apparently. One of the things, so in addition to my work as a person in recovery, started as a peer, I'm also a social worker. And thinking of ecological systems theory, Brofferman's work is often talked about in the way that people get support and these things that are made available to them. But the piece that's often missed is the perception of the benefit and utility of that support, right? And I think in any evaluation is talking around referrals, resource navigation, community connectors. I absolutely love. I don't know who said that, mainly because brokering gives me a really bad taste in my mouth because of patient brokering. But I think one key element of this that has to be included, right, in meaningful ways where certainly consent is there is people's perception of the utility and efficacy, not only of being connected to larger resources, but actually, was it the right resource? Was it believed to be perceived as beneficial? And you may have said that they're included in that, but I think if it's not, it's missing a big component, right? Because even looking at it just from the staff perspective, the role they play in the community, if not actually asked if it was helpful or perceived as beneficial to the person getting those resources and connected to them, is a piece we often miss. Not suggesting y'all are, but I would offer that that's got to be, I think, a really important piece of evaluation. Because oftentimes, even as peers, right, the things we give to people don't work out. And we don't often be able to close that loop, or do they come back? Can we get them a better resource, et cetera? And I think we, from a practice and evaluation standpoint, we've got to do more there.
Yeah, 100%. And I think that kind of goes with our continual need for like data, and then also, you know, when it comes to bandwidth and things that we can do within that like one fiscal year, and kind of going what you were saying, Patrick, of really planning ahead too for evaluations.
Yes, yes. Thank you for that, Robert. That was and it's something that we're doing, but we're not doing it to the fullest extent that we should be, just because of what Taylor said for right now, bandwidth. What we're trying to do is kind of lay this foundation this year. So for next fiscal year, we'll be able to open up the bandwidth to be able to have more, because the whole thing of this for me is to highlight the stakeholder voice, right? And like the people who are actually receiving, who are actually using services and are providing services. And I think that that's such a critical point to include in an evaluation. And I think it'd be really, I didn't think about it being that beautifully tied. Of course it is, to sustainability. And I think that's how we can advocate, right, for us as a team to be able to kind of try to free up that bandwidth so we could be able to do that, so we could really piece that picture together in a nice way and holistically. So thanks for that. Patrick, are you going to say something before I cut you off? Sorry.
Yeah, no worries. Like I said, I ended up talking plenty. I was kind of thinking along somewhat similar lines, Robert, like, so if I understand correctly, so let's say, you know, there's some organizations, y'all work with them to build capacity as far as them being able to do this thing, right? To do the resource brokering, right? That's the point. We want them to be able to do this well, so we work with them so they can be well. And the question is, after we do that, do they keep doing the thing? Are they still working well? Right, or it's still doing the resource brokering or whatever. And as I was thinking about that, as I was trying to construct, like, what is the question here? I was thinking along similar lines with Robert, but more like, yeah, it's going to look, you know, different between individuals as far as like what people need. Like if you have this, here's all these resources we can connect you with, right? Not everybody's going to need all of those resources. So then it becomes this idea of like, are people getting connected to the resources that they need, right? Or that they value, I guess is the way like Robert was putting it. And so some way to measure people, here's their needs and the things that they value and they could get some value out of, are those connections being made, right? And that's a tough one, right? I mean, I could think of, you know, some instrument development that might work as far as that type of stuff. Definitely y'all are probably hitting on the right thing as far as qualitative and just trying to sort of pull some stuff out of more qualitative data. But I think with that, over time, you can probably develop some type of instrument that gets at our needs being met. I think is, if we were to boil it down to one basic question. And are those needs being met in a way that's just going to keep being met? Do they this capacity that they have gained, are they going to keep doing that 10 years down the road, 20 years down the road?
Yeah. Roxanne, wanted to say something.
I mean, I think, and I think everybody's established here, right, that the sustainability is going to be measured in a bunch of different like gauges, I guess, right? So one's going to be qualitative, something's going to be quantitative. I think a lot of the sustainability measurements would happen, you know, like through follow-up, or if these people are utilizing the resources themselves with no longer having to use the coach, that would be a good tool. But that's kind of after the fact. I don't know if that I don't know, helps, but yeah, it's kind of after the fact, but it's like if once they're walking on their own and we're not following them or pushing them or holding their hand, right, then they've reached some point of sustainability. And you know, that 10, 20 years, that's really hard to gauge because of addiction in itself, right? So what's going to be the time measurement for the sustainability? Maybe a year, 2 years, you know?
Right. Yeah.
Anyway, just thoughts.
Great thought. Thank you.
Dr. Broom, do you wanted to add something?
No, I just wanted to agree with the points. because I'm loving this. Thank you all so much for your input on this. It's incredibly helpful.
Oh, thank you for being part of the conversation. Richard.
Yeah, I think I just wanted to kind of add a little bit when we're talking about just the need, the whole idea is for the recovery coach or the peer to work with them long term, right? And that engagement. So when you're looking at that, but then there's also the intensity of need is what is that individual? Are they successful? Are we meeting their needs? And the whole idea really is for that individual themselves to identify what their needs are and then help them connect to that and then determine whether that's effective or not and then continue to move on. But then as that person continues to improve or, you know, their journey of recovery continues to move maybe in one direction or another, hopefully in a successful way, then that will phase out, right? And then the number, the frequency and the amount of time that you're spending with that individual is going to become less and less at some point. Although theoretically it can go on for years and years, and much like curing cancer is 5 years, you know, the ideal time to work with that individual is for a period of at least 5 years, and then they're in remission. And that's kind of just an example of that, and how we measure that when you look at what that looks like, both in frequency and in services and effectiveness of services.
Thanks, Richard.
You know, the other thing I was kind of thinking about is some of the work that's been put out by Texas Christian University in terms of like organizational climate and functioning. You know, and like we're talking a lot about kind of the positive pieces that come along with being community connectors, but I could also see that introducing like chaos and disorganization and some stress. And so like, I think also attending to trying to measure some of those barriers for providers to figure out where those touch points are and points for intervention at the systems level would be another important factor to kind of try to identify and measure.
Thank you.
Yeah.
That's great. Absolutely. And that's something that we're tuned into. I'm an implementation scientist by training. So we're tuned into barriers and facilitators. And I don't think we're quite ready to take the next step in terms of our providers. We're trying not to overwhelm them with a ridiculous amount of data collection, right? They're already kind of stressed and burnt out. We require them to do trainings and a lot of different facets, which is also what makes this evaluation interesting because of where the relationship that we have, right? But most certainly is something that we are trying to actively collect or even like scratch the surface of right now moving forward. But organizational culture and climate are key.
I think Robert had a question.
Yeah, I have a habit of just my brain putting stuff in chat. But yeah, just looking at where the benefits may rely, especially on the resource brokering piece, I'm still there, but not necessarily the things that may be more mixed methods, but when survey fatigue, data collection fatigue comes into play, looking at where you can use administrative data from these providers, electronic recovery record or electronic health record, especially around efficacy of connection, and other elements from the peers, maybe something to look at that you can add to your analysis to reduce some of that fatigue. Again, you can't do semi-structured interviews and focus groups that way, but there may be elements of it that you can reduce fatigue by adding that component of like some health services research perspective or methodology.
Yeah, I was actually thinking about something similar too, Robert, with the like, can you measure changes in the linkages being made, right? Like people showing up and that type of stuff. But then it's tough because were the linkages needed in the first place, right? Like County A, where there's no change, County B, there's this giant jump in like people being connected to services. There's nothing to say. People in County A just didn't need them, right? They had the higher levels of recovery capital or, whatever it happens to be. So yeah, y'all brought a interesting puzzle.
Anything else? Questions, comments? Still have some minutes left.
Thank you all so much for these insights. This is incredibly helpful. And also realizing, this is resource brokering. That it's interesting how the response in this group to that particular term. So that's something I think that I want to bring back to my group to discuss a little bit further.
Well, it's tricky because that is a term used in PRSS, right? At least in, kind of traditional conceptualizations of it, but it does have those negative connotations outside of it. It's just brokering, right?
Right. And I think we were dubbing, it was more so capacity building that we're talking about. That's kind of somewhat facilitated through resource brokering. And we kind of took on that term just internally as our own group. But that's really important for us to think about kind of moving forward as well. So I appreciate the insight on that particular language is important. We know that. So I appreciate that. Yeah.
Yeah. Emily, would you like to give us like a possible summary of the session? If possible, if there is a way to link the didactics with the case, if that's possible, that'll be great.
I don't know, but I will do my best. Yeah, thank you, Andrea. So we had a wonderful kind of start to the session, really focusing in on, how do we really understand if the work that we're doing is making an impact, right? We can't do this kind of work by randomizing people to one service or another, typically, especially with recovery supports. But we still need a good way, a valid and rigorous way to measure that. And so Patrick gave us a really nice overview of the many different ways to do that statistically. And so I would say definitely for community folks, like partner with statisticians who know how to think about that before you even start collecting the data, so that you have the data where you can kind of marry those together. And then I do think it links nicely with the case that we discussed, because it is really thinking about, when you're talking about sustainability and really being able to engage folks in your community and these services over time, you're going to need to look at the things that you're implementing and whether or not they're engaging people and you know how to do that. And so we went off on some tangents there, but it all kind of comes back to that bigger picture of understanding, for the resources that we're investing in our communities through these programs, how can we understand the kind of impact they're having and ways that we can kind of measure that and document that so we can continue getting funding for these services for this really important work. So that is my summary.
Okay, thank you. That was great. Well, I just want to remind all of you that after this class, we're going to be sending you an email with a post-session survey. Very important for us to hear your ideas and any suggestions that you may have in terms of topics or speakers. So please take the time to answer that survey. You will be qualifying for a $30 gift card. That's a perk too. And also the material and the presentation from this class is going to be emailed as well in that same communication. So I want to thank all of you for today's conversation. It has been great. Please remember to text your code so you can obtain your CMEs. Try to do that today before 12 at midnight. Thank you to all of you, and we'll see you next month. Thanks.